Hi friends, thanks so much for coming back. I'm so excited to film this next video because it is probably the #1 most asked question that I get from most people that I see and talk with and interact with, and it is about my skincare and what do I do about wrinkles, about fine lines, about colors, about texture. And so if you want to hear about how to take care of your skin to make it look beautiful and shiny and ageless, keep on watching. And remember, subscribe below, give it a big thumbs up if you like it, and hit that notification bell if you want to be notified on all my videos that are coming up. So without further ado, let's get started. Okay, so the #1 thing that I get asked all the time is, Rouge, how do I take care of my skin? It's discolored, it has brown spots, it has red spots, it's got wrinkles, it's got acne, it's got pimples, it's got texture. And I wanted to show you what I look like without any makeup on. I had just literally just washed my face. I do have some eyebrows drawn in because otherwise life would not be a dream. Nothing else on my skin, no moisturizer. I just washed it with some regular face wash, and I'll talk about that in a second. So #1 thing with skin and just kind of making the skin look the best is genetics. Genetics does play a huge role in how our skin looks. Based on the way our parents look or our grandparents look or aunts and uncles, we can see kind of how our skin will develop over time as we age. With good genetics, then go thank your mama, give your grandma a big old kiss because they did a great job. Fortunately, I have pretty good genetics. My grandma had beautiful skin, my mom has great skin, and they never put anything on their face. And that's the other thing that I want to say is there are a ton of beautiful, really good smelling, really nice textured feeling lotions and creams and ointments and things out there, and I've tried them, and a lot of times my skin breaks out, especially right in this area. In fact, I do have a little bit of scarring. I'll zoom in close so you can see, and a little bit of discoloration right here that has resulted in just when I've used various different masks or lotions or creams from anywhere, just because they smell good or there's a name brand to it, and I break out. I get texture right here. Once I got texture all over my face. It was right before a date. I was mortified. I had to like slather on the foundation, which quite honestly just made the whole thing more magnified. So I don't know if I would recommend that. Maybe just feign some sickness and tell them that you'll go out with them next week. I don't know. I've tried all the different products, and sometimes I break out, sometimes I don't. So if you have sensitive skin, you know, be careful what products you use, because fragrance, the more chemicals that is in the product, the more I find that I personally break out, and just kind of my skin just doesn't like it. I would go with the mindset of the less the better. The less stuff in the formula, the better. Just the cleaner the product, the better. Now, with that said, I don't necessarily think that going all natural will prevent any of the breakouts, because I have tried all natural products and my skin has not responded very well to that either. I've turned orange actually at one point. These are the things that have worked for me. I am obsessed with it. I recommend it to most of the people that I interact with and ask me these questions about how to take care of my skin and what should I do on a daily basis, and there's research that has backed it up. Some of these things that I'm going to talk about are prescription strength, and some of them are not. With the prescription strength, I will say that you should absolutely talk to your doctor, your provider, your PA, your nurse practitioner, whoever is the person who manages you, who may write this prescription, because there is some side effects to it with pregnancy specifically. You don't want to use it when you're pregnant, so definitely before you run out and buy some of these products, talk to your medical provider and clear it with them first to make sure that they think that it's a suitable product for you to use. So I wake up in the morning, and the first thing that I do is I wash my face. Now, you can use any skin cleanser you want, any face wash you want. Try to get one that doesn't leave your skin feeling really, really tight afterwards, because you don't want to overly dry your skin. You want something that is going to just gently cleanse your skin. I don't have a particular go-to product right now. Right now I'm just using this Jan Marini face cleanser that I just got. It's nice. It does a fine enough job. I've used Cetaphil face wash. I liked it. Neutrogena, I've liked it. CeraVe, I like it. I've also used some higher brand named ones. Try them all, and quite honestly, most of them do a fine enough job. When you cleanse your face, what I do is I take a small amount of the product, warm water, and just kind of wash my face. In terms of cleansing, I think that some of those electronic products are just too abrasive. So just your sweet little hands and some warm water and a little bit of face cleanser just to kind of wash your face. So that's the morning. So first step I do, wash my face. And then what I do is I use a vitamin C skin serum. Now I've done a ton of research on which one is the best one to use, and hands down it's this one right here. And this is not sponsored because I don't have that many subscribers yet. Where is it? Can you guys see this? CE Ferulic Acid by SkinCeuticals. Here's the thing with this. Vitamin C is what you need to brighten your face. This is going to be just kind of that, you're going to get that result in your skin that just glows, that Jennifer Lopez shine, that inner shine. It helps also lighten up dark spots. I have a dark spot here that I'm working on right now. You are someone who has a little bit more hyperpigmentation or darkening of the skin in various different areas. This is going to be your heavyweight right here, the CE Ferulic Acid. Now, I talk about the SkinCeuticals brand because it is heavily researched. The product itself has a couple different components to it. It has the vitamins, and then it has vitamin E in it as well. And then it has this thing called ferulic or ferulic acid. Vitamin C is kind of temperamental. It doesn't necessarily get absorbed into our skin very well. So it needs kind of like a bus to take the vitamin C and drive it into our skin. And that's exactly what the vitamin E and the ferulic acid do. It takes the vitamin C, puts it in the E ferulic acid bus, and then drives it into our skin. And it gets absorbed, and that's when it starts doing its brightening and lightening processes. I've tried a few other different vitamin C products that don't have the E and the ferulic acid component to it, and it's made my skin turn orange. It's caused more darkening of my skin, and sometimes it just doesn't do anything at all. So I don't really want you guys to waste your money. I know that the SkinCeuticals brand is fairly expensive, but it is proven, and you don't need that much. When you open the bottle, it comes with a little eyedropper like this. You see that? And all you do is you take 4 little drops. It says 4 to 5 drops, and honestly 4 drops is enough. So you just take 1, 2, 3, 4 drops. Take a little dab of it on your finger, and then just take a little dab of it. And then what I do is I just kind of dot it all over my face, and especially on the areas that I have the dark spots, I just kind of go into that area a little bit more. When you open this bottle up, the color of the product is orange, so don't let that scare you. That's normal. It hasn't gone bad. That's exactly the color that you want it. It also does not smell very good. It smells pretty funky. That smell will go away also when you put it on your face. Put it all over your face, rub it in, and then, which is probably the best thing that you can do for your face, is you want to use a sunscreen. This is the sunscreen that I'm using right now. Again, it doesn't matter what brand, whichever one works for you, whichever one isn't going to break you out, whichever one gives you the most sun protection. We absolutely want to put sunscreen on our face every single day because I see a lot of people that come in with various different discolorations of their skin, cancers of the skin, and only in hindsight they say to themselves, gosh, I wish I had used sunscreen. Make sure to put the sunscreen on the tip of your nose and above your ears. I always see people forgetting that. Most places that I see skin cancer is here on the ears, right on the nose, and then right here on the forehead. So that's my morning routine. A cleanser, any brand, CE Ferulic Acid by SkinCeuticals, vitamin C, and then followed by sunscreen. Now it's time to go to bed and do your nighttime routine. Same thing. What you want to do is wash everything off. I use the same face wash that I do in the morning. Pat it dry. Now this is the nighttime heavyweight. It's Retin-A. This is what you want to talk to your doctor about because it has side effects to it. I'm going to talk a little bit about how to bypass the side effect. It can have some dangerous side effects for those who are pregnant or breastfeeding. So, and it's a prescription. So definitely talk to your doctor before you go run out and get this product. Retin-A is by far the #1 thing that has helped me and my skin, and it helps keep it the way it does. It helps with fine lines, it helps with dark spots, it helps with redness, and of course it helps with acne, which is what we're commonly told that it does. But it does those other 3 things, and it really, really does an amazing job. You don't need a lot of the product for it to work, and you just have to use it every single day for the rest of your life, and your skin will just look amazing. Your skin sheds and kind of turns over naturally. And what Retin-A does is it speeds up that skin cell turnover process so that you're constantly left with beautiful skin on top of your skin all the time. And because it's speeding up the skin cell turnover process, you have a less chance of getting wrinkles. And I especially have wrinkles right around my eyes, and so I concentrated in that area, and I'll explain to you how I do that in a second. But it helps with wrinkles or fine lines, not deep lines, just the thin little fine lines. It helps with dark spots like this guy right here, or sometimes you'll have like random little dark spots on your face. It also helps with redness. Same thing. Redness is here. It exfoliates off, and then the new skin comes up here. And it helps with acne, of course, that we've just always known about. Some people are afraid of Retin-A, or tretinoin is the generic. It's all the same because it causes their skin to get red, flaky, and super dry, and that's absolutely true. And the reason why it does that is because exactly what it's supposed to be doing is it's speeding up the skin cell turnover process. So it's essentially exfoliating your skin. So a lot of times when people come and say, oh, I don't like Retin-A because it just made my skin so dry and I just started to get really flaky, and I think to myself, oh my God, you got the perfect result. It's doing its job. Your skin is doing exactly what it should be doing. Keep using it. Don't stop, because once that dry, flaky skin kind of stops happening, you have this gorgeous, beautiful skin coming up from underneath it. So you just kind of have to brace yourself for that 2 weeks to a month until all that top skin kind of comes off, and then you have the beautiful skin coming. What I do is at night I wash my face and then I pat it dry. And for newbies, this is what I recommend you guys do. Be bone dry. My skin is bone dry right now. And then you take your Retin-A or your tretinoin. I recommend, if you're nervous, starting off with the lowest dose, and your doctor can talk to you about, just sort of introduce your skin to this new product. And then you're gonna take a pea-sized amount. A pea-sized amount is half my fingernail. You do not need a lot of this product, and it will last you forever. This is all you need. Do you see that? That's nothing. In fact, this is probably a little bit too much. And I take a little bit of the skin, and exactly how I did the vitamin C in the morning, I just dot it all over my face so that I get a really nice coverage, all over coverage. See how much product is still left? I put a little bit on my nose over there. And then just because I have fine lines around my eyes, I kind of dab a little bit on my eyes too. Look at all that product I still have. I can do my entire neck. In fact, I am gonna do my entire neck. You can put this product anywhere. If I could bathe in this product, I would. Okay, so now, and I don't like to waste it, so I put it all over my face. So now that I don't have any more product left on my fingers, I start rubbing it in. And you just, honestly, you just rub it in, just like that. When you get around your eyes, be really careful because you don't want to get this product inside your eye. That's gonna make it burn. So you just kind of put it all over your face. It'll feel a little sticky. And then wait maybe about 2 or 3 minutes, and then put a moisturizer over your face and then go to sleep. When you wake up in the morning, you do the morning portion. So your face wash, your vitamin C, and your sunscreen. and that's it. And you just do that cycle over and over again. And in my experience, I have just been able to maintain pretty much really nice skin. Now, for new people, when you first start the Retin-A, what I recommend to kind of help overcome that really dry, super flaky, red skin that you'll get, use the product every other night for 2 weeks. That way you're kind of introducing your skin slowly to this product. What I found is if you use the product every other night for 2 weeks, and then after that use it every night, you're kind of, like I said, gradually introducing the product to your skin, and your skin won't get so angry. Don't give up when your skin gets flaky and is just peeling, because that's exactly what the product should be doing. It's exfoliating your skin and getting that new beautiful skin to shine, and the old skin is being removed. Another thing when you use Retin-A is you really want to be careful when you go out into the sun, because the sun will do two things to the Retin-A. One, it'll deactivate the mechanism of action, and it will actually prevent the medicine, because it's medicine, from working on your skin. So it will prevent that skin cell turnover process. So all that work that you did for at nighttime to put it all over your face is kind of fruitless, because the sun deactivates it. And that's why the sunscreen in the morning is really important, because even though you've washed it off, the product is inside your skin. So you want to protect it, and you want to protect your skin. So sunscreen is important. And two, it can turn your skin orange. So we wash it off, put the sunscreen on, and the sunscreen will prevent it from making your skin turn orange. So you just want to be careful when you are using this product. It's wonderful. I love it. I think it's done wonders for a lot of people. I really hope it does wonders for you. Let me know if you do try it, and if you like it, and if you've gotten results. You will not get overnight results. This whole regimen will take probably a good month to 3 months for you to start seeing some results, but honestly, stick with it. It's been my go-to skin regimen. I tell all my patients about it all the time. I see results. I really hope that you liked this video. Remember to give it a good thumbs up if you leave a comment down below about what you think. And remember, don't be beige, be rouge like the color. I'll see you next time.